All right, thank you. Welcome to the Senate Committee on Education, and welcome to all of those that are here online and present by phone. Will the Secretary please call the roll?
Vice Chair Dondero Loop.
Here.
Senator Hardy.
Here.
Senator Hammond.
Here.
Senator Lang.
Here.
Senator Buck.
Here.
Senator Dunyate.
Here.
Chair Dennis.
Here. Thank you. All right, so I believe everybody is here. So those on video, just keep yourself muted when not speaking. And as always, our committee information is available on Nellis, which can be accessed through the legislature website. Also, if testifying, providing public comment, register to participate through Nellis, and you will receive an email confirmation with the call-in information. And then instructions are available on the help page, which is linked in a banner at the top of every page in Nellis. And when testifying, state and spell your name and affiliation, if any, and we'll take public comment at the end, limiting it to 2 minutes per person. And feel free to submit full comments in writing and briefly summarize them in spoken testimony. And you may also submit written comments as outlined on the agenda by emailing or faxing them to the committee manager. With that, I'm going to go over the agenda real quick because we've got to change. Senator Harris, who is going to present 224, is not able to present today. So we're going to pull that one for today. And then we are going to go with SB 342 first, and then SB 272. So with that, I'm going to open the hearing on SB 342. And let me pull it up here real quick and then I'll introduce the speaker. SB 272, sorry, wrong one in front of me because I don't have it. Well, I know that we have our presenter for 342 here with us. I believe we're going to start with Michael Flores, and we also have President/Governor Sandoval with us also. So if you guys want to go ahead and begin your presentation.
Mr. Chairman, this is Brian Sandoval, for the record, President of the University of Nevada, Reno. With your permission, I'd like to defer to Chairman Dubrava to make opening remarks on the bill. Perfect.
Thank you. Go ahead.
Thank you, Chair. Good afternoon. My name is Mark Dubrava, D-O-U-B-R-A-V-A. I am the current chair of the Nevada Board of Regents, and I would like to thank Chair Dennis, Vice Chair Dondero Loop, and the members of the committee for the opportunity to testify today. I'm here today to testify in support of Senate Bill 342. This legislation is an important next step in the Board of Regents' consideration and review of the proposed affiliation between the University of Nevada, Reno and Renown Health. Being a licensed doctor in Nevada, the progress and future growth of Nevada's medical community and our two public medical schools has been of particular importance to me throughout my career as both a doctor and a regent. And also I have to disclose that I'm a proud undergrad, UNLV, and I received my medical degree from the University of Nevada School of Medicine. This legislation applies to not only the UNR and Renown affiliation, but represents a broader opportunity for medicine and higher education in Nevada that extends to the University of Nevada, Las Vegas. Innovation, collaboration, the strengthening of existing partnerships with both public and private entities, and the ability to build new ones with our community partners is key to the success and future of higher education and medical education. I appreciate the opportunity to be here today and the committee's consideration and support of this bill as we move forward. Thank you.
Mr. Chairman, if I may.
Please proceed.
All right. And again, good afternoon, Mr. Chairman, Madam Vice Chairman, members of the committee. For the record, my name is Brian Sandoval, President of the University of Nevada, Reno. First and foremost, I want to thank Senator Dennis for sponsoring Senate Bill 342. And as Chairman Dubrava described, this bill will provide a monumental opportunity for the University of Nevada, Reno School of Medicine and the Renown Health to enter into a partnership that will elevate the health and quality of healthcare for all Nevadans. This partnership will advance the teaching and clinical research missions of Renown Health and the School of Medicine. Today, I'm joined by Dr. Thomas Schwank, Dean of the University of Nevada, Reno School of Medicine, and Dr. Tony Slonim, CEO of Renown Health. They will walk the committee through the bill and provide an overview of the affiliation or the proposed affiliation between UNR Med and Renown Health. So again, Mr. Chairman and Madam Vice Chair, members of the committee, it's with sincere appreciation and gratitude that you're hearing this bill today, and we respectfully request your favorable consideration. Thank you, Mr. Chairman.
All right, thank you. Go ahead.
Thank you, Mr. Chair. Tom Schwank, SCHWENK, Dean of the University of Nevada, Reno School of Medicine. My thanks to you, Mr. Chair, again, for your sponsorship of the bill and for holding this hearing. My thanks to the committee for their willingness to hear about this exciting venture. And I also express my thanks to Chair Dubrava for coming on to the meeting to express his support. It means a great deal to me personally, as well as to the entire medical education enterprise. My contribution this afternoon will be to describe this proposed integration as an example of what 342 would allow, and to describe the benefits to UNR Med in particular, but perhaps more importantly, to describe the benefits to the community. I'm not an attorney or a legislator, but my understanding is that NRS 396 and 281 do allow for these types of partnerships, but that 342 provides much more clear direction to the Board of Regents for managing some of the personnel and contractual aspects of these partnerships, and gives more clear guidance to all of us for how to manage this consistent with Nevada statute. So I will describe some of the features of this proposal so you understand the types of partnerships that this bill would help. The basic overview in a single statement is that what this proposed integration does is to allow the creation of a very robust and high-level partnership between a medical school and a large healthcare system. This type of partnership exists for nearly all medical schools in the country. There are 152 or 154 MD medical schools in the country, and of those, at least 140 have high-level integrations like this, and many of these date back decades. They are well known. Harvard, for example, has these types of relationships with their teaching hospitals, Washington University with Barnes-Jewish, and there are dozens of examples of these types of partnerships. And the reason that they have these is because medical education and medical research is changing so dramatically and requires a very large and high-level sophisticated clinical platform within which to accomplish its teaching and research missions. Medical schools are fundamentally different than any other school at the university. So colleges of engineering do not run factories, for example. Colleges of businesses do not run businesses. A college of education does not run schools, but medical schools have to have a very large and sophisticated clinical platform within which to accomplish its missions. So I will describe some of the features of this proposed integration so you get a sense for what 342 would do. And I will focus certainly on the benefits to UNR Med, but I also will focus on the benefits to the community because that's ultimately what this does. The overall integration goal is to develop an integrated clinical enterprise. So the clinically facing sides of the medical school with our counterparts at Renown Health, so as to have an integrated approach to our educational missions and our research enterprise. And we look to have a shared vision, to have aligned governance, and to have unified leadership for the clinical components of these two organizations. The mission overall is for Renown Health and the University of Nevada, Reno School of Medicine to commit to elevating the health and quality of healthcare for all Nevadans. And this commitment includes a particular focus for those who are underserved in support of our diversity, equity, and inclusivity goals and the reduction of healthcare disparities. As an aside, I will note that we have received feedback that some may believe that this partnership would reduce our commitment to underserved patients and to the Medicaid population in particular, and that is absolutely false. We are very clear about our continued commitment to these underserved populations, and I believe this partnership actually expands our ability to meet that mission. The vision for this partnership is to advance the health and healthcare, the teaching, the clinical research missions of both Renown Health and UNR Med, again, for the long-term benefit of the community. Let me run through several key points of the relationship. As I've said, the fundamental objective of this affiliation is to take the clinically facing components of the School of Medicine and marry those with the corresponding programs at Renown Health so as to create a robust clinical platform that would support our teaching missions and our research missions. This is what would allow, for example, for the possibility of an increased medical school class size in the future, new residency programs, new fellowships, new training programs that would enhance care in the community, expanded access to care for the entire community, new clinical research programs that would change the way medical care is delivered. That's what this proposed integration is fundamentally about. This is not a privatization of UNR Med. There are major components of our school, our basic science research, which is so highly rated, our basic science instruction, our laboratory programs, our preclinical instruction, medical school admissions, our pipeline programs, many aspects of the school that will continue to be accredited as a state-funded public medical school. And the fundamental reason for that is so as to maintain affordable tuition and maintain access for Nevada students, as well as our ability to continue to serve underserved patient populations. We intend for this agreement to be very long-term. There may be different numbers that we apply to that. At the moment, the agreement specifies a 50-year commitment just so we have an extremely long-term horizon, but there are many checkpoints along the way, and there are mechanisms for termination under extenuating circumstances. There's a reason for that long-term horizon. As is true for other medical schools and healthcare systems in the country, there are inevitable bumps in the road. These agreements are complex. They involve large, complex missions and institutions. And what we want is the ability to ride over those inevitable speed bumps with a long-term commitment to each other so as to maintain our focus on the benefits to the community. What we do not want is to have some of the inevitable glitches that come up to cause future leaders to say, well, we tried that and let's just walk away. We want to maintain a long-term vision. There's an emphasis on integrated operations and governance whenever possible so as to achieve better outcomes and efficiency. A notable example of the proposed integrated governance is the appointment of the UNR president to voting membership on the Renown Board of Directors. Another major example of this integrated governance is that the dean of UNR Med will also serve as the chief academic officer of Renown and thereby responsible for all teaching and research programs amongst the two partners. The president of UNR, under the authority of the Board of Regents, is the appointing authority for the dean, who also serves as the CAO, the chief academic officer. but with substantial input and consultation and agreement from the renowned CEO. And the reason for that is to maintain that commitment by both senior officials to that critical bridge. The Dean CAO will be responsible for all academic and clinical research functions within both partners, including serving as chair of an affiliation oversight committee, an executive committee to manage the partnership. The Dean CAO will also chair the Graduate Medical Education Consortium Council, which is a council that includes renowned membership, UNR membership, and VA membership, because those three entities come together to manage all of our residency training programs. UNR Med continues as the sponsor and the sponsoring institution for all residency training programs and has operational responsibility for those programs, again, under the Dean, Chief Academic Officer. Primary oversight for all academic activities, as is clear from the above, is the responsibility of UNR Med. Primary oversight for all clinical activities is the responsibility for Renown Health's clinical operations leadership. There's a reciprocal integrated governance, and that is that a senior clinical leader at Renown, in this case, the Chief Medical Officer of the main medical center, will come across to the School of Medicine to serve as the Senior Associate Dean for Clinical Affairs on the medical school dean's cabinet, and thereby reporting to the dean. So there's a reciprocal crossover relationship there. University Health, which is our clinical corporation, a separate corporation but highly integrated with the school, will transfer to Renown through a member substitution agreement so that the corporation as a whole moves over to Renown Health. Renown Health then is responsible for all clinical infrastructure, all clinical staff, but not faculty. That's a key distinction. So responsible for clinical staff, but clinical faculty members continue to be appointed to the school. Renown Health would be responsible for the installation of all clinical operations. So for example, the new EPIC electronic medical record installation would be their responsibility. All clinical staff, again, employed by Renown, but not clinical faculty members. Renown to be responsible for all clinical expenses, such as currently leased space. And Renown Health would then provide reimbursement to the School of Medicine for the clinical portion of all of our physician faculty services. And finally, to wrap up, there are some substantial funds flow agreements that are part of this. It is commonplace in all of these agreements that the health system makes a commitment, a financial commitment to academic investment in the School of Medicine. In this case, initially Renown has committed to an academic support payment of $1.5 million to the school to support academic programs that then support clinical distinction and grow clinical programs in the community. So it's an example I would offer of how academic success and clinical success come together for the benefit of both partners and for the community. And finally, scholarship support. Renown Health is committed to $350,000 a year at the moment for scholarship support. That concludes my portion of the contribution, Mr. Chair. Thank you.
Thank you. I am going to turn it over to my vice chair to handle the rest of the meeting as we get going. In my haste to get the meeting going, I forgot that I needed to have her do it while I was doing my own bill. So I'm going to make sure that she can handle that and take care of that. So do we have other, and before I do that, is there anybody else that needs to give comments?
So Dr. Tony Sloan, I'm the renowned CEO, I think will be our final presenter and to make comments.
Okay. Perfect. And then I'll have Vice Chair take over. Thank you.
Very good. Thank you. Chair Dennis, Vice Chair, and committee members, thank you again. I appreciate the opportunity to be included in the presentation and support of Senate Bill 342, a short but very important bill. Renown Health, a locally owned, operated, and governed private, not-for-profit integrated healthcare organization, has been a longtime partner of the University of Nevada School of Medicine since its very first class of residents. We're excited about the opportunity to develop an even stronger affiliation that we believe is in the best interest of students, as it relates to their clinical education and the community for their health and their healthcare. We also believe that we will be able to work together and strengthen our workforce in Nevada as we continue to invest in the health and healthcare needs of our communities. We think that this public-private partnership also had the added benefit of enhancing research in Nevada beyond what either organization could achieve individually. This is a contemporary model drawn from around the country, and is notable because we will now be able to work together to help improve our state's health more efficiently and effectively than we could do singularly in the past. And this bill also allows the regions to do good things that enhance our community's health. Thank you for allowing me to participate today in support of this bill, and I'm happy to answer any questions.
Would you like me to go ahead, Mr. Chair?
Yes, please go ahead. Thank you.
Thank you very much all for presenting today, and thank you for being here. And committee, I would ask if there are any questions. Senator Hardy, please go ahead.
Thank you, Madam Vice Chair. I have to disclose I was born at Renown before Renown was Renown. My firstborn was born at Renown before Renown was renowned. And I went to UNR when it was a 2-year school, and that's when UNR was UNR. And I obviously have deep ties. I think this is a wonderful partnership that you're doing. And as I look at my role in full disclosure as Clinical Education Associate Dean at Truro University, I suspect that this will open up GME opportunities as well as clinical rotations for medical students throughout the state and maybe even from out of state as we become a full-fledged medical university-oriented center. I think it's going to lift all boats. And so I'm curious about the GME prospects and the clinical rotation prospects that may be available.
Tom Schwenk for the record. I think you're absolutely right, Dr. Hardy. I think that this opens up tremendous opportunities across the state. And I should make clear, I neglected to do so, that this bill is expressly written to include both UNR and UNLV because we believe this is the future of medical education and medical research across the state. I wouldn't want to speak directly for Dean Mark Kahn, but I have discussed this with him, and he has expressed his strong support and looks forward to the time when UNLV may take advantage of this, although I will say that their relationship with UMC is already at a somewhat higher level, and I suspect he would like to do even more in that regard.
Well, the second part of the question is when Roseman comes on board and when Turo's still on board, still opportunities for clinical rotations for medical schools students?
I think that we would be very receptive to more cross-fertilization of students. As you know, residency education is much harder because there are very strict prohibitions with regard to where residents rotate and the funding sources and responsibility for those residents. Students have a bit more breadth. We already have a number of our students, of course, going to Las Vegas for rotations in various facilities, and we'd like to see more of that.
Guess I didn't hear the complete answer. When Roseman comes on board and Turo's on board, we still have opportunities to do clinical rotations with medical students.
I'm sorry, I must have broken up. Yes, medical student exchanges are very welcome in any of these partnerships, I think. What I said was that residency rotations are much more restricted and for various funding and and other reasons, but medical students, I think, are more mobile in that regard.
Appreciate it. Thank you.
Thank you, Dr. Hardy. And I know when you were born because my brother was born before there was a hospital in Carson City, so they had to go into Reno. So we've come a long ways. So thank you for your comments. Any additional questions from the committee? Senator Lang, please.
Yeah, thank you, Madam Chair. So I'm wondering, I know that the nursing programs, the medical programs at UNR are at capacity and they're really difficult to get into. Will this partnership allow for more students for you to be able to expand the program and have more students get into the program?
Yes, Tom Schwank for the record. I think that's part of the plan. I would say that we have to, go carefully and make sure we're developing the appropriate teaching platform, make sure that we have provided proper faculty development for hundreds of renowned physicians who will come online as teachers. We continue to, of course, have tremendous relationships in the community with hundreds of volunteer community physicians, and those continue to be prized. So, we're very selfish. We're looking for the best of both, which is to have excellent relationships in the community, but also huge input from the large renowned health system and renowned medical group. So that's a long answer to say, Senator, yes, we would like to expand. We believe that we and now UNLV are probably two of the very smallest medical schools in the country. And we've had an excellent pipeline of Nevada students. That pipeline has increased over time with increasing interest in the two schools. So we would like to serve the state in that regard.
Is that it, Senator Lang?
I'm sorry, yes, thank you.
Okay, thank you. I believe Senator Donate has a question.
Thank you, Vice Chair Don and nice to see you again, Dean Schwenk. I just had a quick question. So I started doing a deep dive yesterday as to some of the research between healthcare organizations and medical schools when they collaborate. And there's as you already mentioned, there's wide variance with how institutions partner with external organizations. When I'm reading this bill, does this limit? Is the intent just for a university system to go into an agreement with just one entity, or would it open the opportunity for instance, right now to partner with renowned, or possibly in the future for the UNR School of Medicine to partner with other organizations in similar stances just to start meeting the needs? Is that something that would be entertained in this bill?
My understanding, and there are experts other than me who should comment, what this bill provides is guardrails for the Board of Regents to guide the medical schools in these partnerships. I don't think it speaks otherwise to how many partnerships or exclusivity or other issues. It just gives the Board of Regents some guidance in how to construct these as they come up. I see General Counsel Joe Reynolds is unmuted. He may want to respond to
that. Thank you, Vice Chair Dondero.
I'm sorry to interrupt, but would you all make sure to identify yourself when you speak? It's hard for the secretaries that are listening. Thank you.
Certainly. My name is Joe Reynolds. It's JoeReynolds. I'm the Chief General Counsel for the Nevada System of Higher Education. And to shortly answer Senator Donate's question, the answer is yes. The intent of this is to provide a broader opportunity for other agreements in future agreements, both at UNR and UNLV.
Great, thank you so much. Yeah, I just one last comment. I think that this is a really good bill that can pave the way for increasing access. I know that in the research that I read, a lot of the difficulty that comes with creating a new partnership is, variances with institutional missions and what your priorities are. And I think that you guys did a really, really good job of outlining your internal champions that can help facilitate communication. So this is very exciting. So thank you for that clarification.
Thank you, Senator.
Thank you very much. Additional questions from the committee? And if I don't see you, just unmute for me. I have a question while we're letting everybody process, and I don't know whether President Sandoval or Dr. Schwank want to answer this, but the mention was made that this goes hand in hand with UNLV as well, but the bill itself seems to speak to UNR. Is it? Can you kind of clarify that for me and tell me how that will go about and why is it because you don't have that partnership yet, or give me some information on that, please.
Well, again, speaking as a legislative amateur, my understanding and my expectation is that this should apply to both medical schools, but others may wish to comment in that regard.
Yes, and Dr. Schwank, I hate to.
I'm sorry, Tom Schwank, for the record. Thank you. Sorry, Vice Chair.
I don't want to interrupt you, but thank you so much. President Sandoval, did you have something you wanted to add?
Thank you, Madam Vice Chair. Brian Sandoval, President of the University of Nevada, Reno, for the record. And I'll say very briefly that absolutely the intent is for this to apply to both the UNR School of Medicine as well as the UNLV School of Medicine. So in the future, if the UNLV School of Medicine wishes to have an affiliation with a for-profit or nonprofit hospital in Southern Nevada, this would pave the way for it to do so. It just so happens that at this moment, there is this proposed affiliation between the UNR School of Medicine and Reno.
Thank you very much, President Sandoval. And with that being said, would these be able to partner with our governmental agencies? I realize up in Reno, I believe you don't have a county hospital, but down in Las Vegas we do. So would we be able to do that with this bill, or would it be only private entities?
I would defer to Mr. Reynolds on that question, Madam Vice Chair. Brian Sandoval, for the record.
This is Joe Reynolds for the record. The answer, Vice Chair Dondero, is yes. We specifically included both public and private entities that this would allow partnerships for in the future.
Thank you very, very much for that information. Just want to make sure that we're partnering with all our NCHE pieces, because this is really an important piece for Nevada with our medical schools, and I recognize that being that I've watched it happen. So thank you very, very much. And Dr. Dubrava, thank you for the Board of Regents for working with Chair Dennis.
Madam Chair, this is Senator Dennis.
Go ahead,
Just wanted to clarify, because you asked this question, and in the bill, it talks about University of Nevada. And I believe our staff has a clarification on what that definition is, because I think that would clarify what you were asking about. And I believe Ms. Sturm has that answer.
Ms. Sturm, go ahead, please.
Thank you, Madam Vice Chair. Jen Sturm, Committee Policy Analyst. Based on some collaboration I did with our legal counsel, the Board of Regents of the University of Nevada is the language used in the Constitution, which is why it's the language used in SB 342. There is only one university in Nevada, so that does include the campuses in Reno and Las Vegas.
Perfect. Thank you so much for that clarification. I appreciate that. Additional questions from anyone? All right, seeing no hands on that. Chair Dennis, would you like me to go ahead and go to support, opposition, and neutral before your closing comments, or would you like to say something now?
No, go ahead, do the comments.
Thank you very much. All right, we will join our virtual attendees, and when you're ready, we will go to support. Thank you.
Thank you, Vice Chair. To testify in support on SB 342, please press star 9 now to take your place in the queue. Once again, if you would like to testify in support on SB 342, please press star 9 now. Caller with the last 3 digits, 398, please slowly state and spell your name for the record. You have 2 minutes and you may begin.
Good afternoon, Vice Chair Dondero Luke and members of the Senate Education Committee. My name is Sabra Newby, S-A-B-R-A-N-E-W-B-Y, representing the University of Nevada, Las Vegas, in support of this bill. While this isn't necessarily an option that we want to take up at this point, we are thankful to the University of Nevada, Reno for bringing it forward and adding another tool in the proverbial toolbox. So we are enthusiastically supporting their bill today. Thank you very much.
Thank you very much. Next caller.
Once again, if you would like to testify in support on SB 342, please press star 9 now. Vice Chair, it looks like there are no callers in support at this time.
Thank you very much. We'll go to opposition.
To testify in opposition on SB 342, please press star 9 now to take your place in the queue. Once again, to testify in opposition on SB 342, please press star 9 now. Vice Chair, there are no callers in opposition at this time.
Thank you very much. We'll go to neutral.
Thank you, Vice Chair. To testify in neutral on SB 342, please press star 9 now to take your place in the queue. Once again, if you'd like to testify in neutral on SB 342, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 149, please slowly state and spell your name for the record. You have 2 minutes and you may begin.
This is Ross Armstrong, R-O-S-S-A-R-M-S-T-R-O-N-G. I'm the administrator of the Division of Child and Family Services, testifying neutral. I just wanted to note the appreciation in the sponsors indicating that Medicaid patients will be able to continue to benefit from university services. Our universities, both UNR and UNLV, have great partnerships with us to not only help our workforce, but to serve some of our neediest kids. I look forward to continued additional engagement to help alleviate any outstanding fears there that future partnerships may restrict access to those children. Thank you.
Thank you very much. Next caller, please.
Vice Chair, there are no more callers in neutral at this time.
Thank you very much. Chair Dennis, would you like to make closing comments, please?
Yes, thank you. As you've heard from various individuals at UNR, but as you've heard, this is something that can be used both medical schools, and it can provide for better medical education and also better services, even just for medical services for the community. And so while it's a very small bill, I think you can tell what it does. I would hope that we could get support to get the bill passed. Thank you, Madam Chair, Madam Vice Chair.
Thank you very much. And with that, I will close the hearing on Senate Bill 342, and I will hand the gavel back over to the chair.
Thank you, Madam Chair. Since we just heard it, If there's interest in passing the bill now, I would be willing to take a motion. But I want to hear some, see if there's any concerns from the committee.
Move to approve.
Okay.
A second.
Okay, so we have a motion by Senator Hardy and a second. So this would be a do pass, and a second from Senator Donate. Is there further discussion? Yes, Senator Donate.
Sorry about that. I think while I'm fully supportive of it, I would just like to make sure that we have the clarification from legal that I know in the writing, and I think this was what Vice Chair John Darrell was trying to get at. In the writing, it says profit or nonprofit. So I just want to make sure that governmental institutions like UMC would be included in this if UNLV wanted to pursue it. So it's just a technicality. I don't know if we can just take a quick look at that before we vote to pass it, but I am supportive of the bill.
Okay, so let me put it on hold since you have a question. Again, I should have asked, that's probably what you were asking before I took the second, right? So let me back up before we take the motion. Is there a possibility, let's see, where's Ms. Sturm, to see if we could get legal counsel get him on for a second? Or? So we're just going to be on hold here for just a second while we've got our
yes, I can clarify that, Jen Sturm, Committee Policy Analyst. I can clarify that and get back to the committee.
Okay, so we're trying to figure out if we can clarify it now, then we can take a vote on it. So that's why I don't want to do it later unless
Chair Dennis. Chair Dennis,
yes.
I don't want to delay anything, but I would agree with Senator Donate. I think that it would be better to get those answers and then possibly put this on a work session for the next meeting day.
Yeah, so, and we can do that. That's why I was asking questions earlier. If we can get it answered today, if that's the only question that we have, but I want to know if there's other questions because that's the only one that I'm hearing. And if we can get our legal counsel on and we can get that answer today, then we can move forward. I'm just, yes, Ms. Sturm.
Thank you, Madam Vice Chair, Chair Dennis. I did get clarification in case this helps for the committee. The bill allows affiliation agreements with any publicly or privately owned medical facility or related entity, whether for-profit or not-for-profit. So the Board of Regents would be free to affiliate with a government medical facility or a private medical facility of any kind pursuant to the provisions of the bill.
Okay, thank you. Other questions?
I don't know that I have questions, but I don't know that I've had time to process, Chair.
Okay. I'm sorry, somebody else?
Go here.
Oh yeah, Senator Hardy.
I think one of the challenges was, we had the big, huge copy, but not the small version. And that may be part of the problem is finding the actual verbiage. It's on Nellis, but I wasn't able to get the small version, but I got the big version. That may be part of the consternation.
Okay, so let's do this. We'll put it on for our next meeting and so that everybody gets a chance to see that. Because I know we just got it yesterday. It's not a very big bill, so you could actually read it once you get it. But because there's some question as to that, let's hold off on voting, and we'll bring it back at our next meeting, which will be next Monday. So we can bring it back as a work session at that point. So if you have any other questions, make sure you bring those forward so that we can get those addressed. All right. So with that, I see we've got Senator Kiefer here and Senator Sievers. So let's move on to the next bill, which would be Senate Bill 272, which revises provisions relating to education. And I believe we got Senator Sievers-Gansert and Senator Kekeffer that are going to make the presentation.
Thank you, Chair Dennis. For the record, Senator Heidi Sievers-Gansert from Senate District 15 in Northern Nevada. I'm joined by Senator Ben Kekeffer, and we're here to present Senate Bill 272 and also sort of a broad concept on education and how we can recover for the state. So what I'd like to do first is share a PowerPoint with you. All right, can everybody see that?
Yes.
And okay, so again, Senator Heidi Sievers-Gansert, for the record, presenting Senate Bill 272. Senate Bill 272 is part of a 4-bill plan that Senator Kekeffer and I are calling Nevada, the Nevada Education Recovery Plan. Again, the Nevada Education Recovery Plan. And what Senator Kekeffer and I have done is we spent some time with Superintendent Joan Ebert over, I think I was able to talk to her probably 3 times and Ben at least 2 or 3 times to try to figure out how do I help our students. You know, with the disruption caused by COVID-19, our students are experiencing learning losses and feeling disengaged learning from home. And we have some information about learning losses, but not as much as I think we'll gain over time. As I mentioned, there's 4 bills, and today we're presenting Senate Bill 272, which establishes the Nevada Educator Corps. The next bill would be Senate Bill 273, which is around literacy. And then I'll let Senator Kekeffer talk a little bit about his Senate bills.
Thank you, Senator. Thank you, Mr. Chairman and members of the committee. So as a part of targeting both early childhood as well as graduating high schoolers, 2 final bills would be Senate Bill 312, which would be an expansion of our existing pre-K programs. It's an appropriation bill, frankly, to support an expansion of pre-K statewide. And then finally, at the other end of the sort of pre-K to 12 spectrum is Senate Bill 316, which would create a pilot 5th-year program for small pods of up to 20 students in high schools to help them get all of their needs met for graduation, do some dual enrollment, sort of launch towards their college or career pathway. So those are 2 other bills that you may see at some point in the not too distant future, but they're all meant to complement the first 2 bills that Senator Sievers-Gansert mentioned, as well as support the excellent work that Senator Dondero Loop has done with her proposal in Senate Bill 173.
Thank you, Senator Kekeffer. So again, these 4 bills are meant to help our students catch up on their learning losses, and also improve learning outcomes. And they do complement the work of Senator Dondero Loop. All right, so what do we know? Right now, there's not a lot of data out there, but Washoe County was able to present a report in February of this year about the critical absenteeism rates. And you can see, in high school, the rates are as high as 51% versus 17% last year. Middle schools are extremely high. So we know kids are not attending full time. And then if we look at the data before COVID, in 4th grade, our reading scores on the NAEPS test, which is also known as the nation's report card, we were finally reaching peer levels as far as reading. So our 4th graders were reading at virtually the same level as their contemporaries across the US. And this was the first time ever for the state of Nevada. And before that, you can see we were kind of tracking national rates. Then you look at 8th grade, kind of the same thing. We were tracking national rates in reading. And when I go back to the 4th grade, the turn was in 17. So in 2015, 2017, all of a sudden we started to converge for the 4th grade reading scores. And what I thought was really interesting is when you go down to 4th grade math scores, if you look at 2017, that was also a big turning point for us. So all of a sudden we were starting to gain while before we were sort of tracking just along what the national averages were. In 8th grade, the same thing in math, we were kind of tracking along. And so, something that we want to keep in mind is we were making gains. Now we've gone through the COVID epidemic. Students are starting to return to school, have been working or have been attending hybrid, and in Clark County just basically started to return to school. So we're expecting significant learning losses. So we've got to catch up on those learning losses. But I also think we should look beyond that and really try to change the trajectory and continue that upward trajectory where we are finding gains in outcomes, not just tracking the averages across the US. Then we start talking about, well, so what's the state of our schools? In Clark County, this number was used the other day and during one of the finance meetings. So it was presented that 114,559 public elementary school students are not reading at grade level. So this was actually across the state, not just Clark County. So across the state, we know we've got over 114,000 kids who cannot read at grade level. And then in Clark County, we also know that there were 12,000 students who did not have a full-time teacher on their first day of school in fall of 2020, recognizing that they weren't actually in school, they were online, but there still were not enough teachers. And we know we've had a teacher shortage for years. But when I saw this number, it sort of brought it home what the magnitude of that issue is. So when I consider that, or when we consider that, it seems like there's a supply side problem, right? We don't have enough teachers. We have learning losses. We were making some gains, but we're no longer making those gains. So what can we do about that? How do we get all hands on deck? How do we help these students to recover and improve the outcomes across the board? And we came up with the Nevada Educator Corps. The members of the Corps could provide in-person and online tutoring services. Members could be retired teachers, currently licensed teachers, and college students with a special license to teach. And those students in the bill are required to have at least 30 units of college courses. And then this Corps would do a boot camp. So currently licensed teachers will probably be ready to be able to tutor students, but ones who are retired, and especially the students, need to have a short curriculum. And part of that curriculum would be around social emotional and sort of the trauma engaged content that we think the students are going to need, because again, they've been engaged online and disengaged from schools. They haven't been around their friends. And so there's a social emotional piece that all three of the different types of members, so current, retired, and college students, could take. And then the students who are the third category could also have some lessons on pedagogy. How do they put together plans? How do they tutor? How can they best approach that? It's proposed in the bill that the regional professional development programs, the RPDPs, could put that programming together. And that programming would not be 40 hours necessarily. It wouldn't be 80 hours. It would be something where it could be 1 to 3 days to really get these folks up to speed so they can address the needs as soon as possible for the students. We want to help these students recover from learning losses due to the COVID pandemic and maintain and improve the NAEP scores, again, that we were finally making some progress on. So, broadly, we know our students need help. We believe there's a supply side issue that we don't have enough teachers already, and we're going to have these learning losses and also the social emotional issues that come along with what we've faced over the last year. So how best can we approach this? We really think this Nevada Educator Corps is one piece of this broader plan to help our students recover from the pandemic. So, Senator, I don't know if you want to add anything right now. If you do, that would be great. If not, then I can start running through the bill.
No, I think you covered it, Senator. Why don't you go through the bill?
Okay, thank you. So, turning to the bill, let's see. Let me see. I can stop share. All right. So, Section 1 of the bill introduces the concept of the Nevada Educator Corps, and I'm in Section 1.1, and having the department, which be the Department of Education, establishing a database. And the tutoring services would be potentially, this bill is actually written, it's during and after school, but I really think it's mostly after school and potentially over the summer too. The individuals who are eligible are in Section 1 3, which would be retired teachers, teachers who are currently licensed, and potentially students at University State College or community college who've had at least 30 credits. And if they are 3C, the students, they would need to get a special license, which right now the superintendent through regulation can actually provide for a special license. So this would be a limited license for a period of time to be able to do this tutoring. Then when you drop down to section 1, number 4, it talks about payment and hours. And those are a couple things that there's a proposed amendment for part of that from Chris Daly that he'll be presenting. So part of it is we want to make sure that we pay these members enough, but we don't want to conflict with what the collective bargaining agreements are right now. So we have to make sure that we pay them enough, but we don't get in conflict. And then in talking to a couple of the school districts, it appears that they typically use up to 26 hours per week. So instead of 700 hours of tutoring over the course, it would be up to 26 hours per week, so that we again could keep them as hourly workers and they would not be paid benefits. Dropping down to 5, this starts to discuss the training, and the training would need to be differentiated. And as I outlined, there's a social emotional trauma-informed piece that all the different members would need to cover. But then when you have students and potentially the retired teachers or inactive teachers, they may want to brush up and on certain subject matter or on the pedagogy. Then going on to number 7, that contemplates, again, section 1, number 7, the license. So if we have someone who's inactive and their license isn't current, but they are eligible to be licensed, they would be able to get their license for free. And then if they are students, they would be eligible for, again, a special license to make sure they went through the boot camp, through the programming that was available. In section 2, it talks about the funds, and the funds right now in the bill are listed as general funds. And I apologize for some of these amendments potentially, but the bill dropped just a couple of days ago, and then we had a hearing. And as you know, if you're offered a hearing, you just take it. So in section 2, it would not be general fund. That should be ESSER funds. And that would be part of the ESSER funds that are being retained by the state of Nevada. So those are not the ESSER funds that have already been distributed to the school districts or will be distributed to the school districts. This is part of the $47.7 million that are being held back that's available to the Department of Education. And I think that about covers it. So again, amendment pieces would be around the pay, around the hours of eligibility, around the special license, and about the funding that would be used. So I appreciate being able to present this today and the work that I've been able to do with Senator Kiefer, as well as the input that I've received from Superintendent Ebert. Although I haven't had a chance to talk to her specifically about this. We've talked just in general about how we can help kids recover from the pandemic and continue to have better outcomes, achievement outcomes like we saw we were doing before the pandemic hit. So I appreciate those conversations and also the conversations with representatives from both Clark and Washoe County school districts. And I'm open to questions. Thank you.
Thank you very much. Questions? I'm looking for hands. I don't see any hands. Oh yeah, Senator Dondero.
Lots of them. So we heard your bill on the Nevada Educator Corps, Senator Gansert. So I'm wondering, is this just a combination of that bill?
For the record, Senator Heidi Sievers-Gansert, I'm not sure. So this is one bill. This is one piece. This is SB 272. There are several other bills that we have had drafted and have dropped and are referred to the Education Committee, but they are not scheduled yet to be heard. And because we had the opportunity to talk about this one, we thought we should present that we've been thinking more broadly about how we can help our students recover and improve achievement in the state of Nevada. And so that's why I introduced that there's actually more. And then of course, your bill talks about summer education, which I think absolutely we need to be able to do that. It's all hands on deck. How many different ways can we approach and can we help students at different levels. So again, this one is around tutoring for the students that are K-12. We've got 5th-year students that we know we're going to have because some are not going to be able to finish this year. Some we're not sure exactly where they are. So some may not be passing all their classes and some are not being located. We have the pre-K, that's Senator Kekeffer's bill again. And then I've got a bill on literacy because we were finally making some progress on literacy. And I think we should relook at how we're approaching that.
Right. So that's what I was trying to get at, that there are other bills that go with this because I've seen other bills.
Yeah. So we'll have to approach them one at a time, the way that they'll be heard, or we're hoping to have them heard. But this was the first one that was offered a hearing.
So I have a couple other questions. So retired teachers who hold a license, I would be that person. So that's a school district piece. They need to identify those teachers in hard to fill positions, just like we've done in the past with math or science or Title I schools. So I don't think that is a state regulation. I believe that that's a school board regulation. And your 30 hours of coursework, those teachers would be, I believe it now that at least in Clark County, they have to have 60 hours to substitute. So I'm trying to figure out where the difference is there. So if you could address that, I'd appreciate it.
Thank you. For the record, Senator Heidi Seevers-Gansert. So the core is meant to support classroom teachers. And when you look at the students, those are not teachers. They're not considered teachers. They would be considered part of the core and they would be tutors. And so it's really trying to have these students get some training to be able to help these students because of the supply side issue. We do not have enough teachers in the classroom, full-time teachers. We can't hire enough. We do have some retired teachers who have tremendous qualifications to be able to do this. But this is really about supporting the classroom teachers because I think it's just going to be a really heavy lift with the learning losses that they've experienced. And again, that social emotional piece too. How do you help these students get back into the classroom and start to catch up? So it's not intended to be an alternate route to licensure. They're not intended to be long-term subs. They're intended to be part of this core to help with tutoring.
So is this something the Washoe County School District asked for?
No, no one asked for this. This was
okay.
No one asked for this specifically.
Okay, have you had that conversation with either one of the school districts?
Thank you. Again, for the record, Senator Heidi Seevers-Gansert. I've actually had conversations with both school districts. And because this bill just came out, it's been in the recent past, but we discussed what this could look like, how it would fit with what they have been doing or what they're planning to do, and how we could support the teaching in the classroom. And I believe that they'll testify once we're open for comment.
And when you talk about the database of teachers, I guess I'm wondering, is that something that already exists in the Nevada Department of Ed? Is that something they would have to create? Would they need software to do that? I know they keep everybody who has a license in a database, but how would that work exactly?
Thank you. For the record, Senator Heidi Seevers-Gansert. So I believe they have a database already of currently licensed teachers and probably inactive teachers. And so concerning the students, those would be potentially an ad, and that may be messaging to the College of Education, probably at UNLV, Nevada, Reno, Nevada State College, and maybe the community colleges to try to see who's interested in something like this. And again, this is about tutoring, so it's not about replacing teachers. It's not about alternative route to licensure. It's not long-term subs. This is about trying to get more people to be able to help students to reinforce what's happening in the classroom.
If I could jump in quick if I may, Mr. Chairman. Ben Kekeffer for the record. As a parent of currently 2 students in high school, I can say that finding qualified tutors is not always the easiest thing to do, and having access to tutors who have been had some training, are put forward by the school as qualified in the subject matter that you're looking for, as well as having had some experience in providing tutoring services. would be an incredible help to I think, parents. And it's aside from the financial aspect for families that could certainly use the help in providing that extra support for students, which is, I think, another key part of this bill is helping families that don't necessarily have the resources to go out and find it on their own, be able to access those tutoring services potentially for the first time.
Thank you. Senator Heidi Seifert-Ganser for the record. And I appreciate your comment, Senator Keffer, because I believe we have students who are disproportionately affected, low-income students of color, because they haven't been able to get the resources. Some of them didn't have the technology, and then hopefully they were able to get the technology through the different school districts. But they don't have access like more affluent students who either parents can help or maybe there's tutors that they can hire. And so I think there really is a greater impact for low income and children of color. And this really could help them. And that would be something I didn't or mention, is that the schools would be identify the students or prioritizing students who need the most help. And those students then would be assigned tutors to be able to help the individuals. But there would be a process. Potentially they could use the MAP testing, right? They could use the MAP assessment to see who needs the help. It's my understanding that those are given 4 times a year. So what students need the most help, schools can identify them, and then they can be assigned tutors. And in the tutoring sessions, it could be online, it could be in person, it could be 1 student, it could potentially be 3 students from the same classroom. The schools themselves could help decide how that would actually work to make sure that we could help as many children as possible.
Correct. I understand. I know that CIS and Boys and Girls Club and several other after-school programs do these types of things. So would the Nevada Department of Education subgrant this to the districts, or are they hiring these? Are you hiring these tutors? Who hires the tutors? Would it be the school district would have another additional piece to HR, or would the NDE do it, or how would that work out?
Senator Heidi Seifert-Ganser for the record. So the way that it's contemplated right now is the database is established by the Department of Education, but and it would be ESSER funds that are held back by the Department of Education. So the Department of Education would probably work together with the school districts, identifying the tutors. And then I'm not quite sure how the paychecks would roll out. If that's the question is, how do you actually pay them? I'm not sure if, I think that would be something that we could work on between the school districts and the Department of Education. It may be the school districts. But you know, what's kind of different now that we haven't seen before is that we're in this online mode. So there may be tutors who live in a certain region of Nevada that can help students based on their knowledge base and the type of work that they've done that may be somewhere else in the state. It would be great if we could do in person, but that may be limited for some time. So that goes back to the payroll, because if it's somebody in Northern Nevada tutoring someone in Southern Nevada, it would be taught, you know, I'm not sure how that works.
Sure. Yeah, because I just worry about, specifically, I know that not only is the NDE short on staff and are working overtime, but the school districts, HR departments, I just don't know how they would manage, how everybody would manage the tutoring jobs. And I guess you'd have to identify, I mean, I'm trying to think through it. I guess you'd have to identify that the ESSER funds were to pay for this, because they may have already earmarked ESSER funds for other things or what have you. So I was just trying to think through that part. So
no. For the record, Senator Heidi Seifert-Ganser, no, I appreciate that, because those are the details we need to work out. And this is really about kids. How do we help our students? And I know you've been thinking about that. That's why you brought forth your bill. How do we help our students with the learning losses that they're experiencing? And how do we get back on that trajectory where our students are improving, how they're starting to meet peer or maybe exceed their peers across the state? And so it's really about getting them back to where they were and raising the bar. And what I do know about the ESSER funds, the $47.7 million that's being held back, 2.4 million of that is allowed for administration. So there is a portion of those dollars that is set aside for administration that I'm sure will help with any of the programs that they end up moving forward using those funds.
Yeah, I agree. I'm just usually very cautious about trying to tell the State Department how to run their total business, because I think they're working really hard. Thank you for the question.
Yeah, thank you. For the record, Senator Heidi Sievers-Gansert, I completely agree with you. They are working overtime to try to help our students and try to think of ways to help our students. And again, Senator Kiefer and I spent quite a bit of time with Superintendent Joan Ebert brainstorming what are the types of programs that could help our kids. And we do know we have substantial funds from the federal government that are coming down. And just out of the ESSER funds, I think there were $430 million that were processed through an IFC the other day, and then the $47.7 million that went straight to the Department of Ed. So there is funding available. It's how we use it. This is one of the ideas of several, and we'll probably have more, right, to try to help our students. And I'm just grateful for the opportunity to consider this and to think about how we can accomplish that.
Thank you very much. I appreciate the bill. Thank you.
All right, other questions? Yes, Senator Lang.
Thank you, Chair Dennis. Senator Lang, for the record. Senator Sievers-Gansert, I was just wondering, so for instance, I have a lifetime teaching certificate. I can teach K-12, any subject, and it's reciprocal with a lot of different states. But would I be eligible, and would other retired teachers, because a lot come to Nevada, be eligible under 3A to be a part of this program?
Thank you. For the record, Senator Heidi Sievers-Gansert, like, absolutely. You're a highly credentialed teacher, and I know you're retired or inactive right now, but you're the type of person who could help a lot of students. And we need more people like you. And because this is a limited lecture, so they would fall back. Probably if they were out of state, they would most likely, I think, go to the special license category. So they wouldn't be licensed as a regular teacher in the state of Nevada, but it could be the limited special license specifically for tutoring. And we know we have a shortage just in regular teachers, right? So how are we going to help support those classroom teachers? So yes.
Great, thank you.
Thank you.
Senator Buck, I believe that's a question.
Chair Dennis, thank you so much. My question just actually, it's a comment and then a question. 21st century monies have always, been available. You apply for them in a grant form for before and after school tutoring. It helped me with when I was principal of Sewell and then moving to Pinecrest. We also applied for those dollars for before and after school tutoring, and I saw the difference that it made for students. Then my question is, we've always talked about how we want to encourage people into the profession, and especially that subcategory, of course, bringing retired teachers back and having them be back in support of that classroom teacher and of student learning. But also the people that are at the university, say, working on their teacher credential, utilizing them to get them into the profession. So how do you see this as helping the teacher pipeline, which is a crucial problem here in Nevada?
Thank you. For the record, Senator Heidi Sievers-Gansert. I absolutely think this will expose some folks who, students who maybe didn't think about education to get into education. I also think the Nevada Teach program that we have at several institutions in Nevada, I think it's at Nevada Reno and at Nevada State College is helpful too. And that's when you get a dual credential, or you get credentialed for teaching, but you also graduate in a STEM degree, with a STEM degree. So I think this will expose more individuals to teaching and have that experience with students and see how much they can help. And I just think it's all positive. I guess to me, it's all upside, having more people involved with students who have a background and some education to be able to do that.
Ben Kiefer for the record, Mr. Chairman. And just to follow up on that, if you look at paragraph 3 or paragraph C in subsection 3, section 1, if you have 30 hours of credit, that can be in any subject. That doesn't necessarily have to be in education. You don't have to be an education major to qualify for this. And I think exposing more college students to that role of of teacher-student, of helping a younger person with their education, I think it could inspire people to join the profession. I hope it does, because I know that a lot of teachers get an incredible sense of satisfaction over working directly with students and helping their education.
Thank you, Chair Dennis. And just one more comment. I like how this is really a supplement and it doesn't supplant. It really is to add additional help for students. And like with Marilyn Dondero-Loop, Vice Chair Dondero-Loop's bill, I think that this would add a great caveat to get those needed educators into this. So thank you.
Let's see who else? Senator Donate.
Thank you, Chair Dennis, and to Senator Sievers-Ganser and Senator Kiefer for presenting. I like the idea and the conversation on tutoring. Would you consider increasing the credit amount in, what is this, Section 1, subsection 3C? I'm looking at the part where it says a student at a university, state college, or community college in the state who has completed at least 30 credits hours of coursework and obtains a special license to teach pursuant to this chapter. Would you consider removing the special license requirement in exchange for increasing the credit amount? And my reasoning for this is that, you know, when I think back to my undergrad, a lot of my tutors in calc and, you know, bio, like a lot of them were just grad students that were just doing this as a side job. And I think it could open up a really, I don't want that special license requirement to be a barrier to students who probably don't have access to get a good job and just want to do this on the side to support their finances. You know, maybe there's a mediation where like we require them to be at least upperclassmen in college, or, you know, I think that would be a good conversation that we can have in allowing more students. But I think that we can create a barrier if we require a special license.
Thank you. For the record, Senator Heidi Sievers-Ganser. I don't think we want to create barriers, but I do think we're in a very unusual time with sort of the social, emotional, and the trauma that students have had. That's my understanding, is that it's going to be hard for them to get back into the classroom. And so I don't think we want to create an obstacle, but I do think we need some basic training, particularly for those students. And I'm not so worried about the credit hours, but I do think that they have to have some training. And that the threshold, we don't want to set the threshold too high. As I mentioned at the beginning, it could be a day to 3 days, maybe it's 5 days, but it wouldn't be a lot of training, but it'd be enough to prepare them to make sure that they can help these students and they understand how to convey things. And I can tell you, when I was an undergraduate, one of my jobs was tutoring. I was a work study kid and then a financial aid kid. And I tutored calculus. I think I started when I was a sophomore, and like, I didn't know how to tutor, but I could help kids with problems. But for K through 12, I think it makes sense to have some training. The threshold is not going to be extremely high because we don't want to create an obstacle. We want to get as many individuals as possible. But knowing how to present the material and having some knowledge about how to respond, given what the students are facing and what we know is happening with depression and suicide rates and so forth. So thank you.
Other questions? Okay, I don't see any other questions. So we're going to go ahead and move on to the hearing, hear testimony in support, opposition, and neutral on the bill. So, and just a reminder, 2 minutes for each person. And don't forget to state and spell your name for the record. So first, we will hear testimony in support. So BPS, would you please add the first caller?
Thank you, Chair. To testify in support on SB 272, please press *9 now to take your place in the queue. Once again, if you'd like to testify in support on SB 272, please press *9. Chair, there are no callers in support at this time.
Okay. Then let's hear testimony in opposition.
To testify in opposition on SB 272, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Okay, let's go to anyone wishing to testify who's neutral on the bill.
If you would like to testify in neutral on SB 272, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 411, please slowly state and spell your name for the record. You have 2 minutes and you may begin.
Thank you, Mr. Chair. This is Lindsay Anderson, LINDSAYANDERSON, on behalf of the Washoe County School District. I'd like to thank Senator Ganser for speaking with me about this bill. Certainly having the option on whether to engage with additional tutors through the state portion of federal stimulus dollars to support our students is something we would explore as we're building out our 2-year Washoe County School District strategic plan to address stalled academic growth as a result of COVID. There's a couple of amendment ideas and logistical issues that came up that need to be worked out. We're looking forward to be part of that discussion and seeing these additional tutors have access to our students. Thank you, Mr. Chair.
Thank you. Let's go on to the next caller.
Caller with the last 3 digits, 577, please slowly state and spell your name for the record. You have 2 minutes and you may begin.
Chris Bailey, DALY, Nevada State Education Association, the voice of Nevada educators for over 120 years. NSCA has not taken a position on Senate Bill 272 as of yet, but we do appreciate Senator Sievers-Gansert and her intent to expand, tutoring opportunities for students and building this tutoring core. One item that we did flag and we did submit a proposed amendment to the bill is language regarding pay for members of the Nevada Educator Corps. Many of our local affiliates representing licensed educators who are eligible to become members of this Educator Corps already have language in negotiated agreements or collective bargaining agreements regarding payment for this type of extra duty. So we've submitted language in lieu of the $20 per hour rate to make the rate equivalent to the average pay for similar extra duty delineated in those employment agreements between districts and associations representing licensed educators. We'd also add that we believe that active licensed educators should be given priority for available positions with this work. Thank you very much.
Thank you. Go to the next caller.
Chair, there are no more callers in neutral at this time.
Okay, thank you. All right, let's go back. Senator Ganser, do you have any closing comments? Or Senator Kiefer, either one of you, or both of you.
Thank you. Thank you, Chair Dennis. For the record, Senator Heidi Sievers-Gansert. Again, I think this is a time when we need all hands on deck and that these tutors can really help reinforce the classroom teachers. And we do know that our children have had a very difficult time during this period. And so there's going to be a transition into school, and there's going to be catch-up work. And we think this is a good opportunity or one of the ideas that could help our students return to school, be more successful, and then also we want to improve outcomes over time as well, as because our trajectories were moving up. We were finally getting there. We want to continue that trajectory. Thank you. Senator Kiefer, do you have something?
Just a thank you, Mr. Chairman, for taking the time to hear the bill today, and to the committee members for your good questions, as always. And I know you're all laser focused on helping students overcome the challenges that they've faced over the past year and a half. And We appreciate it.
All right, thank you very much. With that, we will go ahead and close the hearing on Senate Bill 272. And I do have, before we go to public comment, we have some bills that came in, and would like to do some bill introductions. So I'll read these off. So we're going to consider BDR 34-843. Hopefully you got a copy of these. I think you were supposed to all get copies of these BDRs. This is an act relating to education requiring the Commission on Professional Standards in Education to adopt regulations related to paraprofessionals and student teaching and providing other matters properly relating thereto. I will entertain a motion to introduce.
Moved.
Motion by Senator Hardy.
Second,
Second, who was that? Was that Senator Loop?
Senator Dondero Loop.
Okay, Senator Dondero Loop. Any discussion? Okay. Let me do. I think I'm going to do all three of these, and then we'll just take one vote, so we don't have to go through everybody on each one of these. So the next one is, and actually, so we'll come back. Actually, we'll do one motion with all three when we do that, when we get done. The next one is BDR 34-528, an act relating to education requiring the Department of Education to review examination and assessments for certain information, requiring the department to adopt regulations that prescribe certain limitations on examinations and assessments, authorizing the Board of Trustees of a school district or governing body of a charter school to request a waiver from the State Board of Education for certain limitations, authorizing the State Board to grant a waiver in certain circumstances, and providing other matters properly relating thereto. Any questions on that one?
Move for all three.
Okay, well, let me introduce the third one, and then we'll do all three. Thank you. And I'll come back to you for the motion. Third one is BDR 34-842, an act relating to education providing for the inclusion of an indicator to recognize public schools that reduce the frequency of suspension, expulsions, and removal of pupils from school in the statewide system of accountability, requiring the Department of Education to develop a statewide framework for restorative justice, providing for the inclusion of unaccompanied pupils in certain procedures related to the discipline of pupils, providing for the consideration of homelessness in the discipline of pupil, extending the requirement to establish a plan of action based on restorative justice to the suspension or removal of students from public schools, and providing other matters properly relating thereto. So now I'll take a motion.
Move again and again and again.
All right. So we have a motion from Senator Hardy to introduce all three. Second from Vice Chair Dondero Loop. Any further discussion? All right. So if the Secretary will take the vote.
Vice Chair Dondero Loop.
Yes.
Senator Hardy.
Yes.
Senator Hammond.
Yeah.
Senator Lang.
Yes.
Senator Buck.
Yes.
Senator Dunyate.
Yes.
Chair Dennis.
Yes, thank you. All right, so then we'll move to the next item on our agenda, which is public comment. Let's open up the public comment. If BPS could open up the public comment and allow the first person to speak.
Thank you, Chair. If you would like to participate in public comment, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 411, please slowly state and spell your name for the record. You have 2 minutes and you may begin.
Thank you, Mr. Chair. This is Lindsay Anderson, LINDSAYANDERSON, for the Washoe County School District, with a good news minute that I think is relevant to both of your hearings today. So I'm excited to share this with you. The DeMonte Ranch High School leadership students put together 550 goodie bags to recognize Renown Health staff at the South Meadows facility and thank them for being an outstanding partner in education. The bags included Hershey Kisses, Lifesavers, and handwritten thank you cards from students. Recently, Renown Health donated $5,000 to DeMonte Ranch High School, and it was used to purchase laptops for students in need. Renown Health has been a partner in education for more than 20 years and received the inaugural Partner in Education Champion Award in 2018. So we thank both the DeMonte Ranch High School students and Renown Health for their partnership in the name of kids. Thank you very much.
Thank you. That's great news. All right, let's go on to the next caller.
Once again, if you'd like to participate in public comment, please press star 9 now to take your place in the queue. Chair, the public line is open and working. However, there are no more callers at this time.
You cut out there. I didn't quite hear. I think you said that there's nobody else. Is that right?
Yes, Chair, there are no more callers at this time for public comment.
Great. Thank you. All right. So we'll go ahead and close public comment. No other business to come before us. Our next meeting will be on Monday. That concludes our meeting for today. Thank you very much. Thanks to everyone who presented. And